Is aneurysms, and there's a couple things you guys have to know about aneurysms. That there's three basic types. Now, the location of the aneurysm is more important than the type, but let's discuss the types. You have three basic types of aneurysms, okay? And an aneurysm is when the arterial wall balloons outward or it just distends for whatever, usually because of hypertension. So in aneurysms, you must control hypertension. You must reduce it in order to control the aneurysms, right? You have a saccular, which is essentially a sac. You have the blood vessel wall, and you have a sac, and that sac may rupture, and that's the biggest issue that may potentially happen with an aneurysm, right? You have a something called the fusiform. This one's a little bit different than the saccular because the saccular, it balloons out only on one side, but the saccular, it's the entire thing. So imagine like this. That's kind of how the the fusiform aneurysm develops, right? And then you have your dissecting aneurysm. Oops, that's just one less. And your dissecting aneurysm, a little bit different. This one happens because of something wrong with the arterial wall. Imagine you have the arterial wall here, but then something happens and the layer separates from itself, like the tunica intima, the tunica media, it separates. And so you have some of the blood that goes in that area. So it's kind of like this. The part of the wall of the blood vessel of the arterial wall, it separates and the blood fills in that little space. Okay, sometimes it's called a pseudoaneurysm, but that's your dissecting aneurysm. Excuse my right, but that's the one, right? Now, what you guys have to know about either of these is that the worst thing that can happen is that it can rupture. And if it ruptures, you have arterial blood just filling up any particular cavity. The most common locations of any aneurysm to occur is the brain, the thoracic cavity, and the abdominal cavity. So what we're talking about here are arteries, right? Your aorta doesn't go to the brain, but you have several arteries and arterioles that normally perfuse the brain. So you can have any of these in that location. And if that ruptures, what's gonna happen? You're gonna die because you're gonna bleed out, right? The thoracic one usually happens anywhere in the thoracic aorta. Okay, this is problematic as well. But then this is a very important one. Hint, hint. Okay, this is known as a AAA, an abdominal aortic aneurysm. And this one usually develops somewhere in the abdomen. And the patient will tell you that he or she feels like a pulsating mass. And when that's present, you should not be pressing down on it too much. You should also know indications that it's bleeding, that it's ruptured. And how do you know? Well, you're talking about arterial bleeding, so you have your vital signs to look at, okay? Initially, your heart rate goes up. You develop tachycardia. The patient becomes restless because the tissues are not being perfused adequately. They may have even pain in the area because the blood is filling up the abdominal cavity, and it compresses on the nerves. And then you're gonna have a drop in blood pressure. You're gonna have hypotension. And then people that are bleeding out excessively like that, they're gonna have pallor, they're gonna have decreased perfusion to the peripheral tissues and things like that. Does that make sense, guys? Okay. Again, keep in mind that in order to prevent any of these complications, you must control your blood pressure. So you have to give the adequate antihypertensives, you have to monitor the blood pressure frequently to ensure that these things don't happen. And remember, if it's AAA, do not press down on the abdominal cavity because you may rupture it. Make sense, guys? Mm-hmm. Okay.